Hi, my name's Rosalind Pearce. I'm Executive Director of Healthwatch Oxfordshire. Our purpose is to hear from people about their experiences of health and social care services, and also to then make sure that those voices are heard by the people who pay for services and those who deliver them. The team adapted amazingly well to the restrictions that were put on us because of COVID, social distancing, mask wearing, being locked down. We developed our use of online surveys, more reach, more work around social media, but we didn't lose touch with being able to actually meet groups and organisations using Zoom, lovely Zoom, but we still kept contact with the groups and organisations that we were working with before. We heard from nearly 8,000 people last year, which was tremendous. We're here to hear from you, from the public, about your experiences. So if you don't talk to us or we don't find you, then we can't do our job. So I'm really pleased about what we achieved last year.
It's really important that Healthwatch Oxfordshire hears from all of Oxfordshire's communities. So we've had to develop different ways of working and reaching out proactively to talk to people. And this is a long process, and it involves getting out there, building trust, getting to know people and working alongside them to really hear what's important to them around their issues around health and social care. So an example of that, this year we've worked very closely with a community group called Oxford Community Action. This brings together Oxford's diverse and multi-ethnic communities under one umbrella. And together we sat down, we developed a project, we designed a questionnaire, we worked with community members to distribute the questionnaire and to really reach those people and hear their voices. So at the end of the project, we also made a film that was taken to the Health and Wellbeing Board by members of the community to get those voices really heard.
Maybe it's more of a cultural thing when you're taught to be toughen up and face the situation and you'll be fine, deal with it.
So yeah, I would speak to my GP, but a lot of people in our community wouldn't do that because of fear of stigma.
People told us that there were significant barriers to achieving well-being, and those were about the underlying drivers of poor health and also the feeling that if they turned to some health services that they didn't represent culturally appropriate support.
I can see it where the resources is, but all these resources are not reaching to our community. Unfortunately, that's why we are now becoming one of the victims of mental health, problems. And I hope the system, will pick up these things and they will do something in the future.
We're now working with community researchers, offering training and support so that they can look at their own communities' issues that they want to look at.
Throughout the year we worked really hard to listen to and support communities during the pandemic. We carried out several projects asking people to share their experiences of what it was like accessing dentistry during the pandemic or visiting pharmacies during COVID, so we could report back what we'd heard to service providers and commissioners. We also played an important role in providing reliable and trusted information about COVID via our website, our social media channels, and in the early days of the pandemic we also produced a fortnightly COVID bulletin. We also worked to highlight the digital divide and raise awareness of the fact that not everyone is online, so we made sure that we had paper copies of our surveys and reports. We became aware that new and emerging communities in Oxford were lacking trusted information about COVID in their own languages. We worked closely with Oxford Community Action to translate and deliver a leaflet about COVID in 5 languages to 700 homes in Oxford.
We started by asking people in Oxfordshire to tell us what were the top 3 issues for them around social care. And based on that, we organised several pieces of work, did some surveys in care homes, asking managers to tell us early on how they were coping with the pandemic, and also with family members to tell us what their experiences were of having a loved one in a care home during the COVID pandemic. There was a big problem with access to personal protective equipment, difficulties getting access to testing for residents and staff. Also, there was a problem around information. There was so much information about the situation and levels of infection, and also guidance on how to manage it. It was rapidly changing and they found it difficult to keep on top of. In October, we followed up this work with another survey to find out how things had changed, whether things had improved. Flow of information had improved and access to protective equipment and testing had improved. But there were still problems with residents being able to access health services like GP practices and dentists. So following up from our report, we're going to be continuing to monitor the situation and recommending that healthcare authorities and care home managers work together to learn from their experiences and to find out what best practices have worked and to recommend those in the future. We also wanted to hear from people who look after somebody in their own home, what we call unpaid carers. So we ran a survey. We heard from 160 people who were looking after somebody, which we then followed up with telephone or video interviews with a small number of people who had filled in our survey. They need to get practical solutions to some of their problems, some of the difficulties they face. So we organised a roundtable discussion with carer organisations and local carers, and we discussed the issues faced and the types of support that they need. Carers Oxfordshire has started a new carers service where they're going to provide a one-stop shop where people can contact them for tailored advice and support, and we're going to be monitoring that as the year goes on to see how well that service is running.
From Healthwatch Oxfordshire.
Hello.
We're currently running a project of what it's like living in the Didcot area in 2020.
So despite the COVID restrictions, we did actually manage to get out and do some outreach work. We went over to Didcot. We managed to talk to people. We handed out surveys. We also ran an online survey as well, so it gave people a different opportunity to fill in the information. So we heard from 146 people who were actually positive about living in the area and being able to get information how to access services. We did hear from about a quarter of those people that they did have issues getting GP appointments. And there was also a small percentage, about 15%, who commented that there wasn't a lot for young people and families in the area as well. So what are we going to do with that? We're now going to take that report to organisations in the area for them to see what we've heard. So in December 2020, we actually ran our first webinar for PPGs to attend. It was really well attended with over 100 PPG members, and they came to listen to the Oxfordshire Clinical Commissioning Group talk about what was a timely subject with the COVID vaccination rollout programme. It gave them the opportunity to listen and to ask questions on that subject. We are now running monthly PPG webinars around subjects that the PPGs are interested in.
This has been really important during the pandemic because a lot of local services have been operating very differently and access to those services has been limited. I think in the last year we've actually helped 147 people, signposting them to the help and advice that they need. Most calls we received were around access to GP services, access to NHS dentistry and COVID-related queries. So one signposting example, we were contacted by a gentleman who was trying to access GP services. So we actually sent him a copy of our Access to Health card, which is just a very small pocket-sized card that we produced. And it was just telling him exactly what he needed to register with a GP, and he didn't need proof of identification. He didn't need proof of his address. So, that was a success story, that helping someone to access a service that they needed. We also have 6 volunteers who work with us supporting our outreach, admin and research functions, and their help has been absolutely invaluable over the last year, so we would like to thank them very much for their support.
We are going to continue to work alongside communities and go into local communities so that we can hear what they have to say. Not everybody has access to the internet, not everybody uses the internet, and there are barriers. Our second responsibility is to make sure that voice is heard around the table where people who pay for services and deliver services. I'd like to say a really big thank you to everybody who took time to talk to us and fill in our surveys, or even just talk to us directly. I'd also like to say a big thank you to everybody who works in the commissioning services or in trusts who have listened to what we've heard from you, and that has made a difference to how they think about services and developing services, and we want to continue that.